Hello, and welcome to the Early Childhood Health Consultation November webinar, LED 101, Implications for Childcare Facilities. My name is Maria Morgan, and I'm the project manager with Early Childhood Health Consultation. Our team is so excited for you to be joining the webinar today. Our program is in partnership with the Wisconsin Department of Children and Families, housed at University of Wisconsin-Madison School of Human Ecology, and funded by the Preschool Development Grant. Our program's mission is surrounding Wisconsin early childhood providers and supporting their health-related questions and offering guidance on best health and safety practices. We envision a sustainable and statewide program utilizing health consultation and centrally focused on promoting the health and well-being of children across Wisconsin. The Early Childhood Health Consultation Program acknowledges the American Indian tribal nations across Wisconsin and commits to a partnership in offering tailored support to best meet the needs of each tribal community. Our program offers guidance on best practices for health and well-being in early childhood settings. Any questions about a specific child should be directed to that child's primary care medical home. So for today's conversation, we will begin with an introduction, have centralized content, learn more about early childhood health consultation services, and offer a few minutes at the end for question and answer. For those interested in continuing education credit with the Wisconsin Registry, please enter that information in the post-webinar survey. A link to that survey will be included at the chat at the end of today's webinar event. For registered attendees, you can expect an email within a week following today's webinar that will include links to the webinar recording, slides, and a few resources. Also, the webinar recording will be available on our website's video resources page, as well as the YouTube channel. There are a few Zoom webinar features we'd like to highlight today. The first is the chat. Feel free to utilize that throughout today's webinar and add your comments directly there. You can use the dropdown and send your comment to the host and panelists or to everyone. We also have the Q&A or question and answer feature. You can type your question and send it anonymously by selecting the checkbox. We also have Spanish interpretation available. If you're interested, select the globe icon at the bottom of the menu bar and select Spanish from the list. You can also select mute original audio if you'd like to listen just to the interpretation. And now I will hand it over to our program director, Dr. Dipesh Navsaria, to talk more about today's webinar.
Good afternoon and welcome everyone. Pleased to have you here today. Today we'll be talking about a very important topic that may be on a lot of people's minds as they think about their centers, which is about lead. We'll talk a bit about how lead affects children's health, where lead hazards might be present in your facilities, how you can reduce those risks, other options that you might have, and of course, throughout this about how we can be an ongoing support for you. I'm very pleased to now turn it over to our guest speaker today, Madelyn Reinagel from the Wisconsin Department of Health Services, who is the Lead in Water Testing and Remediation Initiative Program Coordinator. Madelyn, take it away.
All right. Hi, folks. So today I'm just going to talk to you about some various areas where you might find lead paint hazards and lead and water hazards at your facilities. Talk about how you can prevent exposures, and then talk about some resources that might be available to you as you work in your facilities. If we want to go to the next slide. So to get started, I'm just going to have us go ahead and picture our child care centers and ask ourselves these two questions, which are, where do young children spend their time and how do young children explore their world? I'm sure most of us in here are always working with kids, so these should be pretty easy to answer. Obviously, when kids are playing, etc., they're spending a lot of time on floors. They also might be exposed to areas near windows, near cupboards, and during warm weather, children spend time playing outside, both on the yard and on the porch. Additionally, especially when children are younger, they like to put things in their mouths. The reason that this is something that we need to talk about is because it takes a very little amount of lead dust for children to be exposed, and it's very hard to notice. So if children are putting things in their mouth around porches, windows, or even through their toys, etc., it's very easy for children to swallow this lead dust. Next slide, thank you. Uh, so if we want to talk about how to identify these hazards, there's three main things that we can look at in our facilities. Number one, we will look at structures built before 1978. The reason we look at this date is because lead paint was banned in 1978. So lead could be in any buildings that were built before this. Additionally, it's important to look out for chipping or peeling paint. The reason for this is this is a very good indicator that we're producing lead dust, or even if you have larger paint chips, they're much easier for children to ingest. And then number three, dusty surfaces both inside and outside of your facility. The main areas that we want to look for are floors, windowsills, play areas, toys, and any other items that might be within reach of a child. Next slide, please. So just couple other things to keep in mind that might produce hazards to children in childcare facilities. The main one is renovation, which is why I'm going to really quickly talk about the lead safe renovation rule. This rule applies to all buildings and homes built before 1978 that have children under the age of 6. So this means that if your facility was built before 1978 and you serve as children under the age of 6, then you're covered by the lead safe renovation rule. This means that if you plan to do any work that disturbs your building's paint, you're required to hire a lead safe company that employs a currently certified lead safe renovator. The reason for this is because renovation is notorious for kicking up a lot of lead dust, and we want to be able to employ someone who knows how to keep those hazards to a minimum. Next slide, please. So here's a few additional things to keep in mind for childcare facilities regarding specific regulations. There's a slightly different verbiage for licensed centers and for certified centers. So if we want to take a look at these really quick, they mostly say the same things. For licensed centers, it's important to not have any flaking or deteriorating paint on inside or outside surfaces, and the same basically goes for certified centers. Next slide, please. Additionally, looking at outdoor hazards and recalled products. For licensed centers, it states that a center's indoor and outdoor space should be free of hazards, including any recalled products. And one really important thing to keep in mind regarding recalled products is this can include older toys made with lead paint or any sort of objects that might have lead in them. There's a link that you can go to. I believe that's either included at the end of this or I can locate it otherwise that has a list of all recalled products. Next slide, please. So here are some good tips and good practices to maintain lead safe within your facilities. So first looking at all of the do's, the good things, making sure that we keep painted surfaces in good condition. It's very important that we don't have any of that chipping and peeling paint just because of the high possibility of it creating lead dust. Additionally, if you're cleaning windowsills or window wells, this is one of those areas where lead dust can settle more specifically. Do your best and make sure that you're using damp rags or damp cloths to clean. This is going to make sure that it captures all of that dust as opposed to sending it up into the air. Additionally, as we talked about before, make sure that you hire a lead-safe renovator if you plan to renovate your facility, especially if it was built before 1978. And finally, if you are in a building that you specifically know might be at a slightly higher risk, make sure that you're using a HEPA vacuum to trap dust. A few things to keep in mind to not do in your facility. These are all things that can increase the amount of lead dust that's kicked up into the air. So we should make sure that we're not sanding floors, windows, or varnished surfaces. Making sure we are not power washing exterior paint. Making sure that we're not remodeling our facilities unless we're using a lead-safe renovator, specifically in those older buildings, and not using a heat gun to remove paint. So on top of all of this, I think that it's really important to keep in mind that lead paint is really the most dangerous when we find it in areas that show deterioration. There are definitely buildings out there that have been built with lead paint that was then later painted over or encapsulated in some way. In those instances, we don't have to be as nervous because the paint is covered up by another surface. So just some things to keep in mind that we're not disturbing anything that might eventually cause lead dust to start accumulating in our centers. Next slide, please. So if you are interested in any more information about lead paint in childcare centers, other programs that might be available to you, here's some emails and various handouts that you can search for on the web. The EPA has a really good guidance called Protect Your Family from Lead in Your Home, which certainly applies to child care facilities as well. Additionally, over here at DHS, we have both the Childhood Lead Poisoning Prevention Program, which can help you out if you're nervous of any children in your care that might have lead poisoning, or if you would like assistance with a environmental inspection that might be associated with a lead poisoned child. And additionally, there is the lead and asbestos certification program, which works with lead safe renovators, and they would be able to help you get in touch with people in that sense. Next slide, please. So moving on, as Dipesh mentioned right at the beginning, lead and water in childcare facilities is a little bit more what I'm specifically focused on at DHS, but of course everything is related to lead remediation. So here are some places where you might find lead in your water as well. Next slide, please. So first, just to go over how lead gets into drinking water. Similarly to lead paint, it occurs when materials that contain lead corrode or disturb over time. Particularly, it's caused by hot water construction projects or changes in your water source. For- One second. Very frequently, especially in Wisconsin, we find that even leaded fixtures tend to get encapsulated by hard water and calcium deposits over time. So when we are seeing our high hazard situations, it's caused by changes such as the hot water construction and sources that I talked about. Next slide, please. So this is a big old diagram of all the different places that lead can get into your water. It's a little daunting just because of all the different places that it can hide. But the good news is that it's very uncommon for lead in water to be the main source of exposure to a lead poisoned child. Just to briefly go over each of these exposures, lead solder was used in most buildings before 1986, and this did contain high levels of lead. Additionally, galvanized pipes, while they don't contain lead, can certainly have lead particles attached to the inside that can be released in any sort of high friction environment, such as plumbing projects. Lead service lines also were installed frequently containing lead. I think this is probably the source that most people hear about when they hear about lead service line replacements. This is the pipe that brings the water to your building from the main of your city or municipality. Additionally, faucets, most likely brass or chrome plated, can contain lead, and we see that these produce high levels when water is allowed to sit stagnant in them for a long period of time. There's also goosenecks, which connect the lead service line to that main, as well as private wells. So here are just 6 different instances where various plumbing fixtures can introduce lead into your building. Next slide, please. Here, really quick, is just a brief history of lead and plumbing legislation to give you a better idea of what type of risks there might be posed to your facility. As we mentioned, it was in 1986 that the use of lead in pipes, solder, and flux was first banned. Then in 1996, fittings and outlets, and by outlets they mean faucets, water fountains, and such, those were first added to the legislation. And then it actually wasn't until 2011 that the allowable lead content in all of your fixtures was lowered to 0.25 weighted average. So in the program that I run, we see lead being introduced into water from buildings pretty much within any of this time period, and especially those that are older. Next slide, please. So why are childcare facilities at risk? We ask this question in my program all the time, why it might be more important to get into facilities such as this. And in childcare facilities, we work with the assumption that they have longer stagnation periods than perhaps homes or places that are used every day. In your building, if your water sits stagnant or if you don't use the water over the weekends, over the holidays, or during extended breaks, the water can sit in your pipes and have lead leach into it from your solder or your water faucets. Next slide, please. So all of that might sound a little nerve-wracking. We don't want to have lead being introduced to our water, of course, but there are some very easy steps that you can take to prevent lead introduction to your water source. Number one, definitely the easiest and also one of the most impactful actions is to flush your water sources. Through my program, we do this frequently where we see the difference between stagnant and running water. Running your faucet for only 30 seconds can ensure that any stagnant water is flushed out, and it lowers the amount of lead in your water significantly. Additionally, number two, using cold water prevents the likelihood that the water is going to corrode and dissolve the lead in the pipes. Of course, if you're washing dishes, you're not going to be drinking that water, so it's fine to use hot water then. But if you're going to be cooking or drinking the water, we recommend that you use cold water. Finally, and this is something that I actually just learned recently, it's very important to clean out your aerators. For those of you who are unsure what an aerator is, they are the mesh devices, as you can see, at the end of your faucet that allow for a steadier stream of water, essentially. Those can be removed. And it's important to do so because if your facility has experienced any water being shut off, or if there is any plumbing nearby, sediment, debris, and lead scale can collect in the aerator, and they can introduce lead into your water simply because it sits there and stagnates overnight. As just a quick explanation for why I realize this is so important, one of the remediation steps that we do in my program is to clean out a building's aerators. And about half the time, that's the action that actually completely removes lead from the water that we're seeing. Next slide, please. So to talk a little bit about what I do, since I'm here and since this might impact a lot of you out there, here's just a little bit of an overview of the Lead and Water Testing and Remediation Initiative. Next slide, please. So, first and foremost, I should mention that this program is only available currently to licensed group centers and early Head Start programs around the state. And what this program does is it offers free lead and water testing to these facilities, as well as free remediation. Next slide, please. I'm not going to read all of these counties, but this is currently where we are located. All of the counties highlighted in dark blue have had active programs or are currently running the program in their areas. We are also actively doing outreach to different areas. If you don't see your jurisdiction highlighted on this map, definitely don't hesitate to reach out to me personally, and I should be able to get a testing program set up for you. I'll go ahead and let us look at that for a second longer. Sorry. It's a big map. Yeah, and then we can, I guess, move on to the next slide here. So as a quick overview of what we've accomplished so far, next slide. Currently, we have run the program in 283 centers, and based on the maximum capacity written up for each center, this means that we have worked with about 18,481. Not sure where that lower number came from, but it's definitely the bigger number that is the correct one. To give you a bit of a more in-depth look at how many of those 283 centers produced results with high amounts of lead, we're looking at about 25% of centers having results that have needed remediation in some regard. Next slide, please. What does that look like? So far, the program has replaced about 54 faucets, and we have replaced 7 water fountains throughout centers. We currently have several more plumbing projects occurring throughout the state. And as I said, when we do these plumbing replacements, they do not cost the center anything. They're funded by the program. Next slide. Awesome. So that is my contact information, Madelyn Reinagel at dhswisconsin.gov. If anyone has any questions about either lead paint or wants to get in touch with me about water, I'm happy to chat.
Madeline, thank you so much for that informative run through of lead and all the places it can be. I know that I once had a colleague at a clinic I worked at approach me and asking about lead paint. Her husband was looking to do some home renovation and said, no, we can do this ourselves and I'll be careful. They knew that there had been some prior lead paint in their home. So I ended up printing off a lot of data for her to take home after explaining to her exactly what you did about lead. And luckily, that convinced them to hire a lead safe contractor. Thank goodness, because they did have young kids at home, so that was important.
Yeah, and we see we've seen that story a lot with people, especially in the older homes doing renovations. And unfortunately, we have definitely seen stories of exposures leading to lead poison to children. So.
And many of our attendees may be familiar with why we care so much about lead in children, but I thought I'd take just a moment to highlight the importance. Some of you may be familiar with the name Dr. Mona Hanna-Attisha. She's the pediatrician who really brought the world's attention to the lead in water crisis in Flint, Michigan, several years ago. And she's actually a good friend, and we were just on a stage together in another city where she was speaking at a conference, and I was interviewing her for that. Her book is on the Flint water crisis. The title kind of tells you what you need to know. It's called What the Eyes Don't See. And she very deliberately picked that title because that's the thing with lead. None of us on this, myself included, can look at a child and say, oh, this child has lead poisoning. The only way to know is through testing sources, and then also testing the child's blood to see if they're being exposed to lead. The effects of lead, by the time we see them in terms of lost IQ points or possibly kidney damage or anemia, are things that we'll see well after it's too late for us to be able to make an effective change. And that's why all this matters so much. None of us are going to be able to tell by looking at children. But those are the key reasons. And these are lifelong effects. We can't get those IQ points back. So that's the other reason that we care so much about this. There's a very clear health risk to children, and we're not going to see it unless we test. And that's why all of this is so important. I see some questions popping up in the Q&A and chat. So let me throw some of these out there, perhaps. There's one from Nikki asking about a childcare facility in a church basement. And they've painted the walls several times, but even with the layers, is it possible that the original lead paint is still around, even with as many as 4 to 6 layers? I know you addressed some of that. Do you want to highlight some of the key things that they should be thinking about?
Yeah, happy to. So if it is an older building, there definitely is a good chance that there might still be lead paint present. But it is really good to hear that it's been painted over. So as I mentioned, encapsulation is definitely something that can be done to remediate lead paint within buildings, because that's going to make sure that we're not seeing those paint chips or any of that disintegration that you see in older buildings that haven't been painted over. If you are nervous about there being lead paint present at your center, there are also lead test kits that are available for you to use on your walls or in your windowsills. They're very easy to use, pretty easy to get your hands on, and those can also tell you if there's anything actively present on the outside of the walls, at least. If it's inside, no, that's good news. 6 layers should do it, I would say.
Yeah, I think one way I've heard it described is to look is what's the condition of the top layer of paint like, right? Is it cracking or peeling, and therefore the lead paint layers could be exposed, or is it in really good shape? Is that a
Mhm.
good way to think about it?
Absolutely, yeah. Yeah, if the walls are in good condition, that's definitely good news. If you're seeing shipping paint on the outer layer, it's hard to tell exactly how many layers deep that goes, so that's when we could start seeing those exposures again.
And the test kits, where can people typically find those?
So if you want to reach out to, if we wanted to go back to those emails I put on the previous slides, there are definitely people at DHS that can direct you towards those. They're also available through more regular sources like Amazon and the like. So they're pretty easy to get your hands on, and they talk you through how to do the testing as well.
Right. I think one way to think about it is if you can pick up the lead with a test kit, right, by, wiping a windowsill or whatever, then that means the lead's at risk of getting into kids. If it's sealed back behind something that the test kit's not going to pick it up, then, well, it can't be a threat to kids either.
Absolutely.
Yeah, great. Another question that we have is how long of a turnaround is it to test lead in water in counties that were not highlighted on the map?
That's a really good question. So in the counties that are highlighted, that is where we have contracts set up with your local public health departments. In those instances, the public health departments have the staffing, thankfully, and the time to be able to run this program. But that's unfortunately not the case in every area. If you do want this program to take place in your center, we do also have the ability to walk you through the testing process for you to do yourself. So what I would do is I would set up a training with you to talk about how you would take water samples. Thankfully, it's super easy. You just fill up a bunch of water bottles and then you send them on their way. And then I would talk you through how we would go about remediating anything if you did have problems that arose. So just because you don't have your county highlighted on the map, if you do end up wanting to participate, definitely reach out to me and we should be able to get you set up with something.
Great, thank you. While people are thinking of other questions they might wish to ask, again, please feel free to put in the chat the Q&A, and we'll be happy to answer them. I had a couple of other things to think about in terms of lead. We talked about lead in water. We talked about lead paint. Are there other sources of lead that actually may have nothing to do with the center, but that our early childhood care and education professionals may be able to have a conversation with parents about?
Yeah, so in children's homes, there's definitely all different sorts of exposures that can be found, different makeups or even older cooking supplies. I know we've had people come in from going to a thrift store and picking up old glazed pots or dishes and whatnot. That can certainly be found with lead paint on it, which is, I used to be such a thrifter. It's turned me into such a paranoid shopper. Um, Additionally, just environmental sources of lead. Obviously, we haven't had leaded gasoline in quite a while, but back in the day, that um, lead was introduced to quite a bit of the soil surfaces. So even if your home has been remediated, definitely if your children are playing outside, I ate dirt as a kid, so all sorts of things can get in your mouth in that regard too.
Yeah, it's so interesting, right? Because if anyone has the experience where a parent says, "Well, my child, was tested. He did a routine screening at the doctor's office, and their lead levels came back high." It doesn't automatically mean it's your center. Now, I think you should take it seriously, right? And think about whether it is, because it's not just that child; it's all the children in your center that you may need to be concerned about. But it could be from a number of sources in the home. The home itself could have lead paint, lead water issues. And then, as you mentioned, unfortunately, there's some makeups. There's other products. I've also seen like some toys, unfortunately, that are
Yes, yep.
still not so much made in the U.S., but with global economy, it's things get through, and there can be lead paint on those toys as well.
Yeah, it's important to watch those recalled lists for toys that are out there. As you said, there are things that seem to slip through every year that get recalled that had lead paint. So very important to keep that in mind. I also will mention too, in terms of a poison child and their exposures, it is a cumulative thing. So most of the time we're looking at if it's in a children's home, it's from a source such as the paint or something else specific. But the reason that we're also focused on childcare centers is that we don't want them going from one exposure to having more being introduced over time.
And folks may be wondering about treatment, like, if a child is exposed to lead, they have a significantly detectable lead level in their bloodstream. Thought I'd briefly address that. The the vast majority of the time, what I've seen clinically in my own years in practice, was that usually the main thing is remove the source of lead exposure and then let the body clear it out on its own. There are fairly extensive treatments that can be done. They usually require hospitalization, and there can be some pretty significant side effects. So I've almost never seen or heard that being done, at least not in the last few years. But usually it's a remove the exposure so you're not getting that cumulative kind of long-term exposure that you just talked about. And because otherwise you end up just re-exposing them over and over and over again. Hey, I don't see any other questions at this time. Maria, shall we move ahead?
Thank you. And thank you all for including your questions. We invite you to add further questions for the remainder of our time, either in the comments through the chat or in the Q&A. And at the end of today's presentation, we will have more opportunity for question and answer. But before we get there, let's talk a little bit more about early childhood health consultation and other program services In addition to our webinar trainings like the one we have right now, we also have numerous other resources available. Centrally, we're focused on supporting the health and safety within early childhood settings. And we invite you to explore the resources, including on demand and our resource library, including a new health policy template wizard that just launched a few weeks ago. We also invite you to check out our podcast, Teachers, Toddlers, and Tissues, where the sticky, icky world of early childhood and health meet, and also our health consultation or tailored services. We're excited to share how fast and across Wisconsin, our health consultation services are expanding. As you see with this plum color, these are all of the additional communities that we are supporting. And we're excited to share that's over 1,000 active early childhood care providers across Wisconsin. Starting this November, we will be expanding again. Our health consultation service locations new are all noted in gold. We invite you to check out our website for more details. As mentioned moments ago, our podcast is also available, Teachers, Toddlers, and Tissues. Feel free to subscribe and listen in using your favorite platform. And there you can find a collection of 8 different episodes all available. You can go to our website for more information. We also invite you all to save the date for our next webinar, scheduled for Thursday, December 7th from 1 to 2 p.m. You can go to our events page for more information and a registration link to come soon. There are a few different ways to reach our program. You can contact us via phone call or text, email, website, and also on social media. We'd like to say a special thanks to the many early childhood providers that offer us ongoing guidance and best meeting the needs of programs and children that they serve, including our very own ECHC Advisory Board of Early Childhood Providers. We'd like to thank our colleagues from other childcare health consultation programs from across the United States, our CLS or Cultural Linguistic Services team for offering us Spanish translation and interpretation services, our current project partners, and our past project team members. A few reminders: at the end of today's event, we will be including a post-webinar Qualtrics survey link that will be found in the Zoom chat. This is a great place for you to enter feedback in ways that we can improve future webinars, and also to enter your information if you're interested in credit with the Wisconsin Registry. Also, following the event, you can expect a follow-up email with links to today's recordings as well as the survey. And then following the event within 2 weeks, any information entered on the post-webinar survey will be directly entered with the Wisconsin Registry for continuing education credit. So at this time, I'd like to go ahead and pause and see if there's any further questions. To offer an opportunity for both of our channels to come together, we will enable consecutive Spanish interpretation so everyone can participate in this section of the Q&A.
While we're waiting to see if there's further questions, I just also want to comment on something that Madelyn noted earlier, which is about the removal of lead from gasoline. And which is just to note that that has been one of the major public health victories for decades, and has made such a big difference in the lead levels of kids everywhere, since that's airborne.
Mientras esperamos un momento para ver si hay más preguntas, quería mencionar algo que dijo Madelyn hace un momento cuando habló del hecho de que se ha quitado los contenidos de plomo en la gasolina. Esa realmente fue una de las mayores victorias en los temas de salud pública que hemos tenido en décadas, y ha tenido un impacto muy importante en los niveles de plomo en la sangre de todos, incluyendo de los niños, ya que el plomo resultante de la gasolina era algo que estaba en la atmósfera.
All right, I am seeing a question in the Q&A. Do municipalities test the water before it enters homes? Is lead something they look for?
So to my knowledge, there's a whole bunch of different.
Rápidamente, la pregunta fue, ¿los municipios hacen pruebas al agua antes de que el agua entre a los hogares? Si es así, una de las cosas que evalúan es el contenido de plomo.
All right. To my knowledge, there's a bunch of different requirements for types of buildings in municipalities.
Hasta donde sé, hay requisitos muy diferentes, hay una gama de requisitos diferentes para diferentes tipos de edificios en diferentes municipios.
In Head Starts, I know that some of um, the not municipalities, the water utility, there we go. In some Head Starts, the water utility has been doing water testing. And I believe that's going to start becoming more required for utilities. However, not all cities do water testing in child care centers.
En los programas Head Start sí suele haber un requisito de que la compañía que ofrece el servicio de agua haga pruebas y me parece que van a estar aumentando los requisitos para las compañías que ofrecen el servicio de agua para que hagan más pruebas, pero hasta donde sé, no todas las ciudades llevan a cabo pruebas en los centros de cuidado infantil.
I'll also add to that many of the that lead could be coming from the municipal water source, but of course it could be fine and it could be a fixture or a pipe or something of that nature within your building that is the source. So municipal testing wouldn't help in that case.
También algo que agregar es que, por supuesto, podría ser la fuente del plomo el agua que ofrece el municipio, pero también es posible que el municipio entregara agua perfectamente saludable sin plomo y que algo en nuestro edificio, una tubería o algo más, fuera la fuente del plomo. Así que en ese caso, el que el municipio haga pruebas o no, no nos ayudaría a resolver esa situación.
Just to build off of that really quick, I will mention that we have experienced buildings such as schools or even churches that have done lead testing of their municipality water that have then participated in our program to find that lead is being introduced to the water through either water fountains or water faucets in their building, which would not have been shown through the municipality testing.
Continuando en este mismo tema, hay edificios que han participado en nuestro programa, incluyendo escuelas o iglesias, por ejemplo, que llevan a cabo pruebas del agua que reciben del municipio y después participan en nuestro programa y se dan cuenta a través de esas pruebas que algo en su edificio está agregando plomo al agua, ya sea un grifo, tuberías, etc.
I see a question in the chat in Spanish, so I'll allow our interpreters to translate that for us.
The question is, if these tests come back negative, do you recommend retesting? And if so, how long after the first test?
To answer that for, I guess, both kind of like lead paint and lead in water, if your paint has been encapsulated and there's a chance that it's in the building, It's of course important to monitor the condition of the paint, but that doesn't have a big, like a confirmable timeline of when you should be impacting that. It's sort of a case-by-case recommendation. For water, we recommend every 3 to 5 years.
En respuesta a esto, voy a mencionar plomo tanto en la pintura como en el agua. Si hablamos de pintura que contiene plomo y la pintura ha sido encapsulada, como ya mencionamos antes, esto es algo que se debe de continuar monitoreando, pero los casos varían de caso en caso, entonces no les puedo dar como un cronograma específico, simplemente hay que seguir evaluando y seguir poniendo atención a eso. En cuanto al agua, sí se recomienda hacerlo cada 3 a 5 años.
I'll also just add, since it wasn't asked, there are very clear guidelines for when children should be screened, and those may be getting even simpler in the coming months or years. But there are guidelines about when lead screening should be done on their blood. It's in the youngest kids, so around age 1 to 2. Public health departments know that, and primary care doctors and others should also be fully aware of those and hopefully implementing those as recommended.
También algo que agregar es que existen guías muy claras acerca de cuándo se debe de verificar el nivel de plomo en los niños. Y estas guías son algo que se van a simplificar aún más en los meses y los años que se acercan. Esta es una prueba de sangre que se debe de llevar a cabo en los niños más jóvenes, es decir, niños de 1 a 2 años de edad, y es algo que los departamentos de salud pública tienen muy claro y que los proveedores de cuidados de salud, o sea, los médicos y otros, también deben de tener muy claro, y espero que implementen estas guías.
And rather than read you the whole list, in the chat in a moment, I will put a link to the Wisconsin DHS site that summarizes those.
Y en lugar de leerles esa lista de guías, voy a agregar en el chat el enlace al sitio del Servicio de Salud de Wisconsin con esos reglamentos, esas guías.
If there are any other questions, this would be a great time to put them in the chat or Q&A.
Si hay más preguntas, les animo a que las pongan ahora en la sección de preguntas y respuestas o en el chat.
Well, seeing none, and if you think of something later, you know how to find us, and you also know how to find Madelyn, given that since she gave you her contact info as well.
Great. Thank you all for your engaging questions. As we wrap up our time together, we'd like to direct your attention to the chat, where you can find a link to the post-webinar survey.
No veo más preguntas por ahora, pero les animaría que si se les ocurren más preguntas más adelante, no duden en ponerse en contacto con nosotros o con Madelyn. Muchas gracias por todas sus preguntas. Por favor, miren el enlace que pusimos en el chat, que los llevará a una encuesta que pueden tomar en inglés o en español.
Also found on the post-webinar survey, you can use the drop-down feature to select the survey in English or in Spanish.
Una vez que abran el enlace de la encuesta, pueden ir al menú desplegable y seleccionar ahí si quieren llevar a cabo la encuesta en inglés o en español.
And with that, I will turn it back over to Dr. Navsaria for closing remarks.
Y le dejo el micrófono de nuevo al doctor Navsaria para que nos dé la conclusión de esta sesión.
Thank you so much again for being here today. Thank you for all that you do for the children we serve. And thank you for letting us work with our new friends at Cultural Linguistic Services to provide interpretation so we can be as inclusive of all of our early childhood friends.
Pues muchas gracias a todos por estar aquí el día de hoy. Muchísimas gracias por todo lo que hacen por los niños a los que sirven. Y gracias por permitirnos colaborar con Servicios Lingüísticos y Culturales de la Universidad de Wisconsin-Madison para permitirnos ampliar nuestra oferta a todo nuestro público en más idiomas.
Thank you again, Madelyn, and thanks to everyone. Have a good day.
De nuevo, muchas gracias, Madelyn. Muchas gracias a todos y que tengan un excelente día.